Now I will begin my secondary assessment. I will examine the patient's head for signs of trauma. I will examine the patient's face for signs of trauma and for symmetry of the facial muscles. I will examine the patient's eyes for pupil size, reactivity to light, equality, and pink moist conjunctiva. I will examine the patient's nose for any signs of trauma, for drainage, or for nasal flaring. I will examine the patient's mouth for any signs of trauma, for blood, for broken teeth, for a foreign body, or for pink moist mucosa. I will examine the patient's ears for any signs of trauma or any drainage. I will examine the patient's neck for signs of trauma, for jugular vein distension, for tracheal deviation, for accessory muscle use, for stoma, and for medical alert jewelry. I will examine the patient's chest for signs of trauma, for subcutaneous emphysema, for equal chest rise, for scars. I will examine the patient's abdomen for any deviation, for any scarring. Then I will examine the patient's pelvis for any signs of trauma or incontinence. I will examine the patient's legs for any medical alert jewelry or CSM, a distal CSM, or obviously signs of trauma. I will examine the patient's arms for any signs of trauma, for medical alert jewelry, or for distal CSM. And finally, I will examine the patient's back for any signs of trauma, or any paradoxical movements or any scarring. I will reassess mental status and ABCs. I will take a second set of vitals and compare it to the baseline set. I will reassess the effectiveness of anything I have done during this primary assessment, and adjust as necessary. I will provide a verbal handoff of the patient to the EMS personnel. I will, based on my findings, I will state what I believe is going on with the patient, and I will provide a rationale based on signs and symptoms.